to make their own response to that, and of course that'll go back and forth also. And these guys will introduce in a second have been gracious enough to respect those terms. My job is to make sure that people are responding to the actual points. After a period of time, we're going to be opening up to the audience. We ask you to respect the same rules, that is, to summarize what the other person said first, or you might just have a question for one of the panelists. Now, I just wanted to just say one thing. Some of you received some literature when you came in tonight. I just want to let you know that was not part of our presentation. However, they would like some literature to be made available to you as you leave if you're interested in that. Okay? Okay, I'm going to let me introduce the panelists tonight. First of all, Pete Frittitta. Pete is he's Vice President of Benefits and Practice for R&R Insurance. He's had over 20 years of experience in the industry. Pete is the President-elect of the Wisconsin Association of Health Underwriters. He's also a member of the National Association of Health Underwriters, Assurex Global Wellness Advisory Committee, the National Employer Benefits Advisory Forum, International Foundation of Employee Benefit Plans, and he's a faculty member of Lorman Educational Services, and also plays a mean lead guitar, which he forgot to bring with him tonight.
562 that have his lights on. Thank you.
Okay, Dr. Bob Kraig, sitting here with the blue trunks with a white stripe, is Executive Director of Citizens Action of Wisconsin, which is a grassroots citizens organization that's dedicated to social, economic, and environmental justice for everyone. Over the past 13 years, Bob has played a significant role in the Wisconsin public policy arena. He's especially known for developing and leading innovative strategies to make health care reform a top issue in Wisconsin. In 2009, the Wisconsin State Assembly gave Bob a special citation for his work in promoting health care reform in Wisconsin. He's regarded as a policy expert, authoring 9 reports on various aspects of the health care crisis and speaking throughout the country on reform legislation. Jeff Stone, who many of you know because he was at one time the alderman of all of Greenfield, I think, or at least in your district. And now it's a teensy part, but it does include the library. So Jeff has been an alderman. He has also served in the State Assembly for 14 years. And especially relevant for tonight is that Jeff is the chairman of the Assembly Committee on Health. He has been a member or chaired since 2009. Jeff is also the owner of a Greendale, Wisconsin company, the Printing Factory, and the company that he started with his wife, Lynn. And finally, Mike Baer on the end. Mike is the Research and Policy Coordinator for the Public Policy Institute. The Public Policy Institute is established to identify and carry out specific evidence-based policy changes that will help reduce poverty and improve the quality of life for low-income individuals and families in Milwaukee. Mike specializes in healthcare policy research, among other things, and is an expert on the intersection of policy and politics, a strange intersection indeed, and especially the Affordable Health Care Act. So, without further introduction, I will start off. Who's going to go first, Mike or Bob? Okay, Bob, you're up. Incidentally, I'm allowing roughly 2 minutes, but I'm not going to be dogmatic about it, so we'll just see how it flows. Bob?
Thank you very much, Bill, and I appreciate this format. This is a great idea, and it's great to have a good audience just to listen to a different kind of debate that's much more civil, and actually is an exchange of ideas. So I want to thank obviously Jeff and Pete for participating, Mike as well, obviously. So we are the affirmative side for the Affordable Care Act, Mike and I. Now I'll give you the 2-minute introduction to what it is. It really is designed to use our democracy to solve a problem that our market has been able to solve on its own. It's been a healthcare crisis that is deepening, getting worse, and this is a very moderate, market-based approach to fixing a problem and really creating a situation where everyone controls their own healthcare decisions. That's a fundamental value, and where it's your decision, not the insurance company's decision, and where people have basic health security, where everyone knows, has some place to go to get health care when they need it. They can't get good health care at work, then there is some place to go to get coverage. And we believe these are fundamental American values. Right now in Wisconsin, there are 1.3 million Wisconsinites under the age of 65. That's a quarter of the population that have a pre-existing condition that would get them denied coverage if they ever had to buy it on their own. If they're not being discriminated against now, it is because they have good insurance at work. But we now, in this culture, go through 4, 5, 6, even 10 careers. So people face these vulnerabilities. If they ever have to buy insurance on their own as they age, they have more pre-existing conditions. And so this is a fundamental for discrimination. The Affordable Care Act creates a system alongside the current system that makes sure there is some place to go to buy insurance. There is an expansion of Medicaid, what we call Badger Care for low-income people, and this starts in 2014. And then there is a new competitive health marketplace called a health insurance exchange that is supposed to be established January 1st, 2014, where people choose between competing private health insurance plans. And so and the worst abuses are outlawed. They cannot deny coverage. They can't charge a higher rate based on health conditions. Can't throw people off their insurance after they get sick. Can't have lifetime limits or annual limits. Whole number of abuses are outlawed, but you are choosing private insurance with standard benefits packages designed not by insurance companies but by medical experts as to what is needed to be covered. And there are very generous tax subsidies to afford it, all well up into the middle class. Over $90,000 a year for a family of 4 can get tax subsidies to help afford coverage on the exchange. So what happens is people who have good insurance at work keep doing what they're doing. But if they ever need to get insurance on their own, or if they're self-employed, like a farmer, like a consultant, or if they work for a small business. Small businesses right now in Wisconsin, 60% provided coverage to their employees in the year 2000. Now it's 32% and falling. That's because of health insurance hyperinflation. They can't afford it. We've had a doubling of health insurance premiums in Wisconsin in the last 10 years. And so this helps resolve that problem, begins to get control. We'll talk about it more in the debate of the cost prices. So this is a very moderate, market-based American solution to the healthcare problem we have that maintains private doctors, private hospitals, private insurance, but guarantees a lot more control and freedom for people to make their own healthcare decisions, and a lot more security so that people know exactly where to get healthcare no matter what their condition in life for themselves and their families. So that is the overview of the Affordable Care Act. Thank you, Bill.
Thank you, Bob. Okay. Step 1 again, briefly summarize it so that Bob feels good about it, basically what he said.
Thank everyone for coming here and welcome the opportunity. Can everyone hear me okay? Just to restate kind of the key points, your position is that PPACA is a democratic approach which gets rid of some of the market abuses and tries to solve some of the problems that the market-based systems have not arrived at.
If that's not exactly what you meant, Bob, help clarify for people.
I'm just trying to get key points without restating it.
Yeah, I would say,
You're saying it's another system alongside the market system.
Largely democratic, but it's an innovation that's designed to deal with the worst problems in the current system, right? And that being that right now, a lot of people don't have a place to go to get affordable coverage and face discrimination. So it creates a system that helps everyone who's not served by the current system now and is a backup system for everyone else. But I think the key point is that it provides control for everyone. They control their healthcare decisions and security for everyone.
Quick summary, Pete.
Pardon?
Quick summary of what you just said.
So PPACA is a system alongside a market-based system to help regulate, control certain abuses, make sure access is there, and really solve many of the problems that, in terms of uninsured or access because of pre-existing conditions, which you mentioned, all those things.